Good morning, friends, respected chairpersons and friends. So I shall be presenting a work which I have done on dynamic MRA in the management of distensible vascular malformations of the orbit. And this has been done in collaboration with our radiology. So just to have a brief background, the distensible venous malformations of the orbit, they are part of a spectrum of developmental venous malformations that are localized to the orbit. Clinically, they exhibit changes in their size, that is, they produce mass effect on Valsalva maneuver or when the head is placed in a dependent position. They may be extensive, multifocal, combined, and can have very complex structure. The hemodynamic characteristics of DM malformations have important implications in predicting clinical behavior and planning the therapeutic approaches. Now, DSA has always been a gold standard for many years because of its ability to provide both spatial and temporal information about vascular lesions. The technique is invasive and carries a risk of cerebral infarction and ophthalmic artery thrombosis. In dynamic MRA, just to understand that, in the conventional contrast enhanced techniques, they obtain images at a single point of time, that is static picture, and that gives inadequate information regarding the dynamic nature of this lesion. However, in DMRA, it uses 3D time of flight, that is, it makes blood brighter, and phase contrast MRA, it distinguishes blood from static tissue. A typical DMRA can contain as many as 20 plus images at a rate of 1 to 2 frames per second. So the aim of the study was to study the role of dynamic MRA in the distensible vascular malformations by studying the flow dynamics, morphology, and hemodynamic nature of the lesion using DMRA. And the secondary aim was to study the correlation between hemodynamics and histopathology of these lesions. So we had 16 patients, and after a detailed examination, they underwent dynamic MRA. And these are the following imaging sequences which were taken: axial, T1, T2, fat suppressed, and same in coronal, and 3D T1 weighted image was taken, and for a high resolution T2 weighted image with and without Valsalva maneuver. For flow character, the dynamic contrast MRA and post contrast was taken. Now, the surgical resection was done for amenable lesions, and the indications would be pain, swelling, and cosmesis. Informed consent under general anesthesia was done, and intraoperative excision of the mass was done, glue assisted, and specimen was subjected to histopathological examination. The histopathologist was unaware of the clinical diagnosis and the findings. We had mean duration of complaints were 8.9 years, ranging from 0.5 to 28 years, and in the age range of 10 to 51. And these are the various initiating events. Coming to the results, majority had hypointense lesions on T1 weighted image, and just one of them also had a hyperintense. The majority was hypo. And in DMRA, the findings were no abnormal flow was seen, which was suggestive of absence of arterial feeder. And venous flow was seen in 10, that is in the majority. And arterial venous feeders were present in 37%. Now we got intensely enhancing lesion in about 43, and progressively enhancing lesion in 37, and intense enhancement and pooling of the contrast in 18. Now, the surgical group, there were 8 patients who underwent resection, and these are the various findings that they were clinically, they were on hemodynamics, they were diagnosed, majority were hemangioma, then orbital varix and mixed malformation. However, there was a variation in the histopathology. We'll come to that again later. Now, this is an example. As we can see the arrows pointing out, as at various time frames, we can see there is the enhancement gradually appears, and it enhances with time. You can see the time sequence over here. So this is a progressive enhancement. Now here is a young child with a bluish lesion since birth, and you can see the flow voids are there inside the lesion, which suggests some high flow vascular flow through these vessels. And then you can see the intense enhancement which is taking place with the subsequent phases, time planes, and it is suggestive of capillary hemangioma. So we excised glue assisted, and the histopathology correlated with the diagnosis, imaging diagnosis. Here is another patient, a 25-year-old, and she had some history of trauma, and she had a tense lesion on the forehead. Now what we can see that it is hypo-intense on T1 weighted, and on T2 it is hyper-intense, and so we had made a diagnosis of intra-lymphatico-venous malformation. However, the histopathology as seen here showed a hemangioma.
Time is running, please complete.
Okay. I thought there was 6 minutes. Okay, ectatic veins. This was, you can see the dilated veins, and even the sagittal sinus is dilated. So coming to the salient points, all lesions were diagnosed as low flow vascular malformation. Hemodynamic of all lesions, they all belong to low flow vascular malformation. There was 100% correlation between preoperative and postoperative diagnosis of lesion known to have low flow. However, on histopathology, there was 50% correlation with the MRI diagnosis. So there were 2 retrospective studies using dynamic MRA, and there is positive literature on this mode of investigation. And in this retrospective study by Kahana, 5 cases, they showed that it had a greater potential in assessing and managing patients. Now, in our study of
Please conclude. Please conclude.
Pardon?
Please conclude your talk.
Okay. So there are no prospective studies. So to conclude, I would say that the flow rate of the lesion correlates best with the histopathology, and the dynamic MRA avoids radiation. It's quicker and gives information about the hemodynamics of the lesion, based on which treatment planning can be done. Thank you.